Hey, I am Dr. Mark Ellis, and I am the clinic director at the Georgia Chiropractic Neurology Center. We have people travel to our office from around the globe in order to get help with a variety of different symptoms, many of which are pain. So today we'll talk quite a bit about pain generation systems and how to approach those and get them better. At our office, we have skilled doctors in neurological rehab, and one subsection of neurological rehab is fascial mobilization. I'm a founding member of the International Fascial Research Society, and so I've been able to take a lot of that information and utilize it with my knowledge base in brain rehab. I'm also a diplomate of the American Chiropractic Neurology Board, and I sit on the board, and I have taught doctors across the globe about neurological rehab. So what I would like to do today is to talk to you a bit about what happens with pain and what is our approach to helping people with pain. One of the critical and important components of that is when you look at the body. So this is an anatomical model that I designed. This is the first anatomical model on scar tissue and fascial adhesions, interestingly enough. So this is a leg and a knee. So here's your kneecap, this is your knee, this is your pelvis, and then back here we have hamstrings and we have different areas of skin. So interestingly enough, your skin, which we'll talk about, has different layers, and each layer has a different impact on your brain and a different relationship to pain. So when you look at pain and you check someone for pain, you have to feel all the different regions in the body for the pain generators. So for instance, here's the skin, and when you look at the skin, a lot of times you have sharp pain in the skin, and believe it or not, skin movement is as influential on how you move as movement from your joints. Then you have different muscles, and we all know that you have pain generators in muscles. So you can have different muscles that are pain generators, and you have to check that. And then you can go all the way down to tendons. So you have tendons that are pain generators. And then you have bone. There's actually fascia around your bone. I don't know if you can see it on the video, but here is a piece of scar tissue. Like this could be a piece of scar tissue on your bone, and it can be a pain generator. So you'll have to look at bone as a pain generator. You'll have to look at muscles as pain generators. And then you'll have to look at the skin as a pain generator. And wrapping in and around all of these things is fascia. So at any point in time, there are different pieces of fascia wrapping all around this, all the way actually down inside your cells. So your fascia is going to go from your skin and one continuous sheet all the way down into your cells. And it creates what we call a biotensegrity connectome, where everything is connected and influencing each other. So let's talk about it a little bit. When you look at pain, you have different pain generators. So for instance, your organs can cause pain, and there's two types of organ referrals for pain. One is the organ hurts and it refers pain to the skin right on top of it. And the other one is the organ hurts, but it, say like in your heart, it refers pain down your arm or up into your head. And that is called a visceral referral pain pattern. Well, here at Georgia Chiropractic Neurology Center, we always make sure that we check our patients for visceral somatic pain patterns. And we are highly skilled in doing visceral manipulation. So we can mobilize your organs, help them to relax, move better, digest your food better, and block your pain, okay? So that is called a viscerosomatic pain pattern. But another pain pattern is a trigger point. So when you look at a trigger point, you can look at a muscle, and inside of the muscle, you can have scar tissue. So you can have a piece of scar tissue connecting two muscles, and they can cause a trigger point. Different trigger points refer pain into different patterns. So for instance, there is a muscle that called the psoas that's deep in your abdomen, and if you push on it, it actually causes back pain. So it's a muscle that you can't even touch if you push on a person's back. You have to work on the front. Also, abdominal muscles can cause back pain, or common causes of headaches are an area up here. This is called your SCM muscle. And when you work on this, it refers pain up into your head. So a lot of people who have headaches or migraines have trigger points in their SCM. Now, one of the really, really big challenges is they may have already had people work on them for trigger points, but they didn't get the combination of neurological rehab with the eyes and the head in conjunction with neurological rehab with the soft tissue mobilizations. So here, the team at GCNC is trained to look at the muscle and fix it at an advanced level. So again, for instance, when this is a hamstring, but when you look at it, you can either have a piece of scar tissue right in the muscle. So there's a piece of scar tissue here, and you have to treat this a certain way. Or what commonly happens in the SCM is these two muscles will get stuck together because the SCM is actually two muscles, and you have to stretch it apart to get the scar tissue and the fascia in between these two muscles to pull apart. So if all you do is rub it, you're just not going to get it better. You have to actually stretch it apart in order to improve it. And that's a bit of a more advanced technique for a lot of people. It's super important for the SCM in order to get rid of the pain generator. But if your brain doesn't know where your head is in space or how to move your eyes correctly from a vestibular rehab perspective, what will happen is you'll reform your scar tissue. So a lot of people have had the soft tissue work, but they didn't get the brain rehab. Or some people actually got brain rehab even for their migraines, but didn't get the soft tissue work. So here we do both of them together, which changes the whole situation. You also have other pain generators and muscles for head pain, like the back of your head, suboccipitals, your trapezius also does it. So we look through all the trigger point pain generators. Then you have pain generators that can come from different joints. So inside of a joint, when you look in a joint, you can have pain generators in the joint capsule or around the joint or here in the tendons. So again, you can have different scar tissue around your joint or your kneecap that's causing you pain. So you have to look and see, is there a pain generator inside the joint or outside the joint? Because we're chiropractors, we're all experts at working on joints. And for our office, also, we all do what's called extremities. So some chiropractors only work on the spine, but we're skilled in doing all the different joints in the body, the hand, the foot, the knee. So we do the extremities and the spine. But again, we combine the adjustments with the soft tissue mobilization. So somebody could have an injury, say, in their knee, and it can go through their joint capsule, and then it can actually scar up into the muscle and even all the way into the skin. So when this happens, you can have a problem where your knee doesn't move right, your thigh doesn't move right, your hamstrings don't move right, and you actually rewire your brain in order to move incorrectly for as long as you have it. So some people are athletes and they just know how to compensate with their body, but really they could have had a very extensive problem and they maybe didn't have somebody who knew how to do all the different sections, like fascia on the bone, fascia inside the joint, adjust the joint, fascia pulling through the muscle, and then fascia going up into the skin. But then you have to rehabilitate the brain because you've made all these incorrect movement patterns. So practice makes perfect, but everyone says, no, perfect practice makes perfect. Well, a big reason for that is because if you're practicing it wrong, it's called plasticizing it. You're actually wiring your brain pathways incorrectly to move incorrectly, and then you'll reform scar tissue and it'll keep coming back. So a lot of times when people are getting these repetitive sprain strain injuries, it's because either a person only took care of a segment of the scar tissue, or because they didn't know how to rehabilitate the brain as well. So in order to fix them. So sometimes people will lean certain ways or their head will tilt certain ways. And if you don't fix the way their body's leaning, they just keep re-injuring their knee or keep re-injuring their hip or keep aggravating their headache because they didn't get the combined care. So one of the coolest things about what we do here is that we work on the combined care. And that is an exciting and unique component for our office. So let's talk a little bit about skin. When you look at the skin, what happens is there's actually different layers. So you can, on this model, it's a little hard to see on the video, but there's different layers. And each layer has a slightly different response in the brain and a different response to pain generators. So let me just explain a little thing to you real quick. When you look at pain generators, there's different types of nerves. Some nerves are really, really big. Some nerves are really, really small. The very small nerves are more associated with burning, aching, boring, horrible kind of pain. And the really, really big nerves are more associated with sharp pain, like a pinprick or something. Well, the skin has a lot of the really big, super fast nerves. Then the bone has a lot of the slower, more achy, burning nerves. So what happens is different types of pain have higher probabilities of being in different layers of the tissue. And if you understand that, then you get to where you know which tissue you want to look at quicker. Well, with the skin, like it gets the sharp pain. So the skin has these different sensors and it tells you how to move. So for instance, if someone touches your skin one way, you might pull back like this, like if this is sharp. But if they touch it this way, you wouldn't want to pull back. You would go a different way. So believe it or not, your skin is a powerful input on how you're going to move. So when you look at the skin, there's different layers. But if you get a piece of scar tissue in your skin, it can go into different places. So a piece of scar tissue could only stay at the level of your skin and it can influence it. But that piece of scar tissue could go, say, from your skin, okay, and it could go down into your hamstring. And if it goes from your skin to your hamstring, it could affect your hamstring for how it moves your leg, but it could actually go to a different part of a hamstring. So then you would move differently. What you need to be able to do is you need to be able to feel the scar tissue and then feel which part of the body it's going to, and then know how that influences your movement so that you can do the scar tissue correction, fix the muscle, and again, do the brain rehab. So you have pain generators in your skin, and they are very powerful effectors of movement. And they have a tendency to be more sharp, and they make your body like not feel your world correctly because of the scar tissue. You might not see the scar tissue. It can be deeper. So it could just be down here and not coming outside your body. So there's ways that we check it. So scar tissue in the skin, okay? And they could either be from a scar that you see or from one that you don't. You can have scar tissue in a muscle. A lot of times these are trigger points, and you could have scar tissue just in one area of a muscle, or you could have scar tissue connecting muscles together, and you have to be able to feel that. And those can cause trigger points where they refer pain up into different areas that are studied and known. Then you can have scar tissue in between muscles, in the fascia in between muscles, and you have to know how to check for that. Those cause whole areas to have problems because the scar tissue in between muscles will connect them all. Then you can have scar tissue in and around a tendon. So you can have scar tissues on tendons. Tendon scar tissue, sometimes they're like achy and they bore, sometimes they're very sharp. It just depends, okay? So you can have scar tissue on a tendon. Then you can have scar tissue around your joint capsule, and those can oftentimes burn. Then you can have scar tissue inside the joint, and then you can have scar tissue all the way at the level of the bone. Each one of these has different sensations. They integrate into your brain differently. They all require different treatments, and then they require brain rehab and movement therapies to frequently make sure they don't come back. So here at Georgia Chiropractic Neurology Center, our team is trained at looking at the sophistication of this whole level, all the different areas of the pain, different neurological rehab in order to help people. What kind of people do we help? Well, for sure, we help people with chronic pain patterns. Sometimes those pain patterns activate areas of your brain that are related to anxiety and stress. We have some other videos on our YouTube channel about that if you want to look for them. And so it can just be pain, it can be anxiety systems, it can actually cause dysautonomia. So sometimes they're causing dysautonomia, especially when it's a visceral pain, because the visceral pain generator system goes up into your brain and activates areas more powerfully that are your autonomic nervous system, like digestion and things. And so it can also cause these dysautonomias. So we're looking at all of those. So people will come in, dysautonomia, anxiety-based pain, stress-based pain, for sure athletics. People who are in athletics definitively need this level of care. And if you think that you would like to learn a little bit more about the way that we approach this, you can feel free to call our office at 770-664-4288, or on our website, we have a contact form. You can fill it in, and you can set up a free phone consult where we can answer some of your questions and see if we're the right fit for you. A lot of times we have patients that have to travel large distances. So we always want to talk to you and make sure that we're the right fit for you and give you the opportunity to ask us questions to see if you think that you would want to come here. A lot of our patients have medical PTSD. So they've been all around the world and they've tried a lot of options and they've gone through quite a bit. And we understand that. So any questions you have, we're happy to answer for you. Feel free to give us a call if you have more questions. Thanks so much.